Um, this is the timer, and read your question, please.
Okay. Okay. Regarding the blood test, can I see them when I enter the cubicle or after the discussion?
Yeah. You will see them once you enter the cubicle. Don't worry.
Okay. Um, I'm ready. Okay.
Yeah. We are simulating the cases like the exam condition, all right? So read your question. You have 1.5 minutes. Arrange your mind, arrange all the thoughts in your mind, and then we can start after a few seconds. Yeah.
Okay, doctor.
Begin.
Start.
Hello. I'm Mike, the agency number is 053904. Shall I proceed?
Yeah.
Hello. Am I talking to as daughter of Mr. Mac Horton?
Yes. I'm Michael, and I'm sorry, I'm Maria, and I'm the daughter of Mr. Mac Horton. Yes.
Nice to meet you, Marianne. Could you confirm his age for me, please?
He's 80 years old.
Okay. I see from my notes that he came here because he had a new onset confusion. Could you tell me more about it?
Well, I've talked with many people today. I'm not sure why are you asking these questions every now and again, but okay. He woke up confused in the morning, and I called the ambulance, and the ambulance came and take him to the hospital.
I see. Um, is it the first time for him to had such an attack of confusion?
Yes.
Um, could you think of anything that might trigger it?
I don't know. You are the doctor. You have to know what's the problem with my dad.
Yes, I'm sorry for overwhelming you for such many questions, but I'd like to be in a better place for understanding his condition and helping him. So, is it okay if I ask you a few questions?
Okay.
Okay. Before that attack, was he doing anything?
No, he just woke up. He was sleeping.
And did he miss a meal?
No,
Did he got any traumas?
no,
Okay. And during this attack, did he lose his consciousness?
no, he didn't lose his consciousness.
Okay. Did he bite his tongue?
No,
Did he wet or soil himself?
no, doctor, he didn't lose his consciousness. He's just he's awake, but he's talking nonsense. He's confused. He's not himself.
You think he is do an odd behavior or something like this?
Yeah, when I talk to him, he's talking nonsense. When when I'm asking him few things, he just answers the wrong answers.
I see. I see from my notes that he is taking have a condition called COPD and dementia as well. Is that right?
Yeah,
So, do you think there is some behavioral changes other than the normal, which other than the usual, which present with the dementia?
yeah, it's not normal for him. Today, it's not normal for him. Yeah, he has
Any
dementia. He has dementia and he has memory problem, but today he's confused. He's not himself.
I see. Did he have any recent fever?
No,
Any recent shortness of breath?
no,
Any recent cough?
no,
Any bowel changes like constipation or diarrhea or tummy pain?
no.
Any pain while
I don't know. He didn't say anything about this. Wait,
Okay, didn't he complain of anything recently?
sorry?
Did he complain?
Did he?
Did he complain of anything?
I stopped the timer because there's an echo. Dr. Michael, are you using two devices?
No, doctor, this Dr. Saeed his mic is on.
There's an echo at your side. I'm not sure. Can you hear the echo, doctor? If you're using two devices, just mute one of them.
It's not me. There's another Dr. Saeed. His mic on.
Just let me see who is opening my account. Okay, so I'm going to mute all right? And please unmute yourself, Dr. Michael.
Okay, doctor, are you hearing me now?
Yes, I can hear you now better. Okay, so I've stopped the timer, don't worry. So you asked me a question and then I didn't get it. I didn't hear it.
I was asking if he has complained of anything recently.
All right. No, doctor, he didn't complain about anything.
Okay, thank you very much. And going to his general, can I start?
Yeah.
Regarding his general health, does he take any regular medication for the COPD or the dementia?
He's taking salbutamol and another inhaler for COPD, and it's controlled. And for dementia, just vitamins.
Could you tell me about the inhaler for the COPD? Do you know his name?
I'm not sure what is the name. It's salbutamol and another one brown in color, I think. I'm not sure what is it.
Beclomethasone, maybe?
Maybe.
Okay, and by any chance he use any recreational drugs?
No.
Okay, thank you. And going to his general health, does he smoke?
No, he stopped smoking for a long time now.
Does he drink alcohol?
No.
Okay, and um, um, thank you very much for answering my question. I want to ask you about the if you and your father have got enough support around you.
Yeah, he lives with me and I'm looking after him. He's fine. There are carers looking after him as well. So yes, he's okay.
Yes, I'm very glad to hear that and it shows how much you are caring your daughter. Thank you very much. Because I'd like to examine him. I will do a general examination and I'll examine his chest as well. And then I will update you with his test results. Is that okay?
All right.
Thank you very much for letting me examine him. From the results of the tests, I see that he has some changes in the tests. He has low sodium, which is an electrolyte in the body. He might be the main cause of the confusion. Also, his kidney functions, which is creatinine and urea on the higher side, and something called GFR, which is show the function of the kidney as well in the lower side. So it's really important for him now to be admitted in the hospital for more investigations. Is that okay with you?
Does he have any stroke, doctor?
At the moment, I don't. It's really a very concerning, but there is no findings, examinations. There is no signs of a stroke, like weakness or numbness anywhere in his body. So it's unlikely to be a stroke. But we will admit him and we'll do CT brain, which is a scan to the brain as well, to assess if he has a stroke or not. So how does it sound to you?
Okay, it does sound okay. So why do you think that he's confused then?
Maybe due to his medications, maybe the medication he's taking, like salbutamol or things like this, may cause this drop in the sodium. I think maybe he has dehydration as well, causing these symptoms.
Okay.
Move on to the next station.
Time's up. Thank you, Dr. Michael. How do you feel?
Thank you. I don't know much, but there is a clear hyponatremia and the elevation in the kidney functions. I couldn't reach to an exact diagnosis, so I'm waiting for your feedback.
All right, no worries. Okay, so well, did you practice on any confusion case before?
Yes.
Okay, all right. So I thought that I'm thinking that you had you mixed it up with loss of consciousness.
Yes, maybe.
Okay. All right, because you've asked before at the start of the station about loss of consciousness, biting his tongue, biting. I told you that there is no loss of consciousness, and you yet asked about the fits and tongue biting and wetting himself and these things. So all of these questions can be asked in positive loss of consciousness. The patient didn't lose his consciousness, okay? And confusion is different from loss of consciousness. This is for everyone here. It's sometimes people can just mix them up, confusion and loss of consciousness, okay? So loss of consciousness means that the patient had blackout, okay? Confusion means that the patient is conscious, okay, but he's not aware of the time or place or persons.
Yes.
Okay, so once I tell you the patient didn't lose his consciousness, so just close this box and don't ask about the symptoms associated with loss of consciousness. All right?
Yes.
This is the first thing. Secondly, you asked me about trauma, which is okay. But when I told you he woke up confused, this means that he didn't have trauma. If you ask about it, it's not a problem at all. But the investigations are telling you what could be the cause, right?
Yes.
The investigation tells you, all right, there is hyponatremia, and it is severe hyponatremia, and hyponatremia can cause confusion.
Confusion.
Yeah. What is the cause of hyponatremia in this case?
No, I didn't reach that.
Could it be deranged renal functions?
Okay.
Yeah, so deranged renal functions can cause electrolyte imbalance. Okay, so this is the only thing that you can think about in this particular case. The patient doesn't take any medications that can cause this severe hyponatremia. He just takes inhalers. Yeah.
And the dementia medications.
No other medications, just vitamins. Nothing that you can think of apart from the renal function in this particular case. In some cases, you can find the patient is taking thiazide or what else? Citalopram or any medication that can cause hyponatremia. Here, nothing is pointing to something causing hyponatremia apart from the deranged renal functions. Okay?
I said dehydration due of the regarding this. That's the thing that came to my mind.
Yeah. Well, dehydration is not specific to this the situation. It's better to say deranged renal functions or the renal functions are not okay. And most probably the cause in his case is that the salts in his body are not balanced very well because of the renal functions or the kidney functions. Okay. I asked you about stroke, and you told me there are no symptoms, which is good. But can you see this, please?
Yes, I didn't comment on the CT. Yes.
Yeah, you told me we are going to do a CT scan. So just tell her, well, okay, we've done the CT scan, and the CT scan doesn't show any abnormality and doesn't point to any stroke. Okay?
Yes. Okay.
So it's one of the tricky cases, to be honest. Okay? And people just don't know how to deal with the case. We are going to discuss how to deal with the case now. It's a test results case. You have the test results in front of you. You have the examination findings. You have everything that can just help you to minimize your questions. Okay? You went to the loss of consciousness and you asked 4 questions about the loss of consciousness, which is not relevant to the case. Okay, this is the first thing. Secondly, you tried to ask about infections, fever, and whatever symptoms of infections, but the white BCs are okay.
I think it is on the higher side, so I went to the infection to exclude if there is any sepsis, maybe that
Well, the normal is between 4 and 11, and it's 10. It's not it's not even 11. Okay?
Okay.
It's not
Yes.
even 11. So it's most probably not related to the COPD exacerbation or infective COPD. I know that your mind went to that.
Yes.
Okay? But sometimes the COPD is not infective and doesn't cause infection and confusion. All right? So I've just blocked everything that can tell you anything apart from the deranged renal functions. Okay? So the only positive thing in this case is the deranged renal functions. Could be something else that you didn't reach in the case, but when I just prepared the case, it's meant to be deranged renal functions with hyponatremia. Okay? The patient doesn't have a stroke, doesn't have exacerbation of COPD, doesn't have fever, doesn't have anything. Okay? So you can. Did you ask me about any medical condition?
No, because it was mentioned in the stem he had COPD and dementia. So
You
I didn't ask.
can, yeah, and you can ask me, does he have any kidney problems, any chronic kidney disease? You can ask me this question. It is relevant to the case, to be honest. Okay?
Okay.
Yeah, it is relevant to the case. All right.
And does he has already kidney problems?
No.
Okay.
Not known. If you ask me, I will tell you, I'm not sure, doctor. I don't know. Okay.
Okay.
So you don't know, is it something chronic? Is it something acute? Is what is around this point? So what are you going to do?
We will admit the patient and we will involve the internal medicine or the kidney specialist team if they have any recommendations.
Do you need to do ultrasound or CT scan on the kidneys?
Yes, yes.
Yeah, okay. So this is what you need to think about. I have these positives. What I'm going to do. Okay.
Okay. I think you might give fluids through the veins as well and put a catheter for him.
You will give him IV fluids. His sodium is very low, so you give him a hypertonic solution, IV fluids, okay? And you will insert the catheter to check the in and output, okay? And you will monitor his kidney functions, and you will do ultrasound and CT scan on the kidneys, KUP, and you will involve the renal specialist. Okay? This is your
Okay.
management. This is your management. Okay? My concern in your management part that you were not organized. You explained to me what you saw without arranging the thoughts in your mind. You told me, okay, there's a the sodium salt is low in his blood, and kidney and creatinine and urea are high, and the EGFR, which is indicating of the renal function or kidney function, is a little bit low. So we will need to admit him in the hospital. This is what you said. Okay. If I am a relative, I will tell you, okay, I didn't understand anything from what you said, doctor. What's the problem with my dad? Okay, so what are you going to tell the patient? You tell her, well, okay, he has a new confusion. This is something acute or something sudden happened to him. And we've done some investigations in terms of the blood count, in terms of the levels of the salts in the blood, and also some kidney functions, in addition to the CT scan. This is how to explain. You categorize the bloods in categories to explain it to the patient, to the relative very well. All right. In terms of his blood count, it's a little bit low. Your dad is anemic. All right. In addition to the salts, there's a salt called sodium, which is an important salt in the blood. It's very low in his blood, and this is most probably the cause of his confusion. Okay. His kidney functions are not okay, and I think this is the cause of his low salt or low sodium. So he has a problem in his kidneys, causing abnormal salts in his blood, causing this confusion.
Okay.
Got it? So
Yes.
how do you feel now about the explanation? Do you think your way in explanation or my way? Did you understand the situation now as a relative? Did you understand what my dad has and what is the situation now?
Yes, yes. It's better to be organized. Yes.
Okay, so if I am going to give you an advice in this case, just don't mix up loss of consciousness and confusion. Secondly, ask the relevant questions only. The patient has low sodium. You will search for the low sodium causes. You will search for the kidney, what could be causing the kidney problem. Does he have any chronic medical condition in his kidneys? And then you move on to the explanation. Nothing else. You can also ask about shortness of breath and heart racing as a symptom of low hemoglobin. What can be causing the low hemoglobin in this case?
The renal dysfunction as well.
Renal. It can be renal. Okay. So this
We
is
might
how
give
to
him
deal with the case.
erythropoietin as well.
Sorry?
We might give him a hormone like erythropoietin as well to help him.
Yeah, you can. You can. It's fine. It's fine. But this is something that we can, put it at the end of the station. We need to organize our thoughts in 8 minutes. Okay?
Yes.
So you dealt with the case as if it is a history-based case, and it is not a history-based case. You have the investigations telling you that this patient has hyponatremia and deranged renal functions without any signs of stroke. So this is most probably kidney abnormality causing hyponatremia, causing the confusion. So this is your mindset in the case. Okay, I'm going to ask about symptoms and causes of anemia, symptoms and causes of hyponatremia, symptoms and causes of abnormal renal functions. That's it.
Okay, doctor. That's clear now. Thank you.
All right. So this is in terms of history taking. In the management, we've discussed how to discuss the investigations very well to the patient. You categorize, and then you tell your thoughts organized. Well, we have done this and this and this. This is low, this is high, this is blah. Most probably your dad has blah, 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 blah. So do you want to know what is the next step? Yes, doctor. All right, we are going to admit your dad, and we will give him fluids through his vein to correct this low sodium, and hopefully he can get his consciousness after that, okay, or cognition. And for his renal functions or kidney functions, we will need to do some imaging like ultrasound and CT scan on his kidneys or his waterworks to check what is the cause that causing this deranged kidney functions, and we will involve the renal specialist or the kidney specialist. Okay, in addition to that, we will closely monitor your dad. Steps 1, 2, 3, 4, and that's it.
Okay, doctor. Thank you very much.
Thank you. So thank you, Dr. Michael. I'm happy that you've done the case. It's one of the tricky cases, to be honest. Okay. Hopefully after that, you will be able to deal with any test results case, and you will be able to explain the investigations very, very well.
Okay, doctor. Thank you very much.
All right. Was it helpful?
Yes, yes.
Okay.
Very helpful. Thank you.
All right. Thank you. Okay. Any question before we move to the next case, doctors? Any question in this case? It's easy if you just think about the situation and the context and how to deal with the case. All right. And when I told him, when I told Dr. Michael, okay, I'm talking, many doctors asked me many questions. I'm not sure why you are asking me these questions. The relative is frustrated. Then you tell her, okay, I'm really sorry. It must be difficult on you. Many doctors or many colleagues are asking many questions. I know that, but I just want to explain the situation or update you about your dad. And I just need to ask you a few questions to be able to explain everything in the best way. Would that be all right with you? Okay. So this is how to acknowledge or how to show that you picked up that she's frustrated and you acknowledged and dealt with the frustration correctly. Okay, let's do the next case. Dr. Omar, ready?
Yes, Doctor, I'm ready. I just have a question about the previous case.
Mhm.
We used to see the test results in the stem before we enter the room, but here it's written in the stem that's inside the cubicle. So should I tell the patient after greeting him and this just to take a look in this test result to know
Of
what should I
course.
ask about?
Yeah, of course. You can just introduce yourself, greet the patient, and tell the patient, well, I do have some results. Can I just read them in few seconds, if you don't mind, to be able to explain things in the best way? Yeah.
Okay.
Yeah. All right. Yeah, read your question, please, Dr. Omar.
Begin.
Omar Mawad, GMC number 8091624. Hello, my name is Dr. Mawad. I'm one of the doctors in the GP clinic. Am I talking to Mr. Jan McMillan?
Yes, doctor.
Nice to meet you. Can I please confirm your age?
40 years old, doctor.
All right, and what would you like me to call you?
Jahan is fine.
All right, so Jan, I can see from this that you have an abdominal pain. I can see that you are in pain right now. Is that correct?
Yes, doctor, it's here in my upper tummy and my chest as well. I don't know, what is that pain, doctor?
I'm really so sorry about what you've been going through. So could you tell me more about it?
Well, it started suddenly, doctor. Started suddenly. And I don't know. I don't know what's that, doctor.
All right, so since when did it start?
Started suddenly yesterday, and it's getting worse. It's getting worse, doctor.
I'm really sorry to hear that. So can you tell me where exactly is the pain?
It's here in my upper tummy here, doctor. Here and
Oh,
in my chest as well.
all right, so do you feel that pain in the chest too, right?
Yeah,
All right, so did you notice anything that makes it better? Any position?
no,
All right, anything makes it worse?
no.
All right, so have you tried any medication for this pain?
I tried paracetamol, but it doesn't help at all, doctor.
All right, okay. So do you think of anything specific happened just before this?
No, doctor, nothing.
All right, like for example, did you eat from outside yesterday?
No, at all.
All right, okay. So apart from the pain, do you have any other symptom?
No, just the pain.
Did you vomit at all?
No, I didn't.
Any diarrhea?
No,
All right, so any change in the color of your skin?
no, doctor.
All right, okay. So is it the first time you have something like this?
Yes, it's the first time.
All right, so do you have any medical condition I should be aware of?
I have high blood pressure.
All right, so can you tell me more about it since when?
I have, a few years ago, doctor, and I'm with the pen.
All right. So, are you taking the medication regularly?
Yes,
All right. And is it controlled?
yes, it is controlled.
All right. Okay. So, do you feel, apart from the pain, do you feel this pain in your back, for example?
No, it's going to my neck.
All right. And do you feel dizzy because of this?
I'm not dizzy, but I feel like I'm not feeling well.
I'm really sorry about what you have been going through. I will help you. Just give me some minutes. All right. All right. So, do you have any allergy?
No,
All right. So, do you have any family history of a problem in the tummy?
no,
All right. Did you travel recently?
no,
All right, okay. And so you've mentioned that you didn't eat from outside yesterday, right? So did you eat anything specific yesterday?
no, I didn't eat anything. The pain doesn't allow me just to eat anything, doctor. I'm not
Yes,
feeling like I have
I
appetite.
understand. I understand can be a stressful thing to happen. So do you smoke?
No,
Do you drink alcohol?
no,
All right, okay. And so, Jean, do you have any idea what might be causing this pain? Anything in
no,
your mind?
no, no.
All right. So is there anything concerning you?
I don't know, doctor, what's going on. Can you tell me what do I have, doctor, please?
As I understand your concern. I will help you with my best. Just give me a couple of minutes. Thanks, John, for answering my questions. Now I would like to examine you, check your observations, your blood pressure, temperature, your pulse, your respiratory rate, and your oxygen level in your body. And I would like to examine your tummy and your chest. Would that be okay?
Okay.
All right. Thanks, John, for letting me examine you. So from the examination, I can see that there is nothing serious in the chest and heart examination and the tummy examination too. So, and your vitals is quietly good, apart from the oxygen level. So, does this pain affect your breathing?
No, it's not, it's 69, right? 96, 96,
Yes.
6. Yeah, it's 96. Yeah.
Okay. Okay. So, do you have any idea what might be the cause of this, Jan, or anything? Let's see, do you expect anything from today's visit?
Anything to help me in this pain, doctor, please.
Right, I understand.
2
So,
minutes remaining.
well, we can just admit you or keep you under observation to see what's going on. We can run some other investigations. We can do a CT scan, a special scan in your tummy to know if there is anything happened. Might be kind of obstruction to one of the organs in your tummy. We could not know yet, but we need to investigate further. What do you think about this?
All right, doctor. So are you going to send me to the hospital?
Yes, it's better to send you to the hospital to exclude any if there is any serious condition. After doing such an scans and some investigations, rule out the serious cause and give you a medication for this pain. Hopefully, we can
Okay.
see what's going on.
So what do you mean by obstruction? Uh, what organ in my tummy that you are talking about, doctor?
Well, you've mentioned that you have this pain in the central upper part of your tummy, right?
Yeah.
So it might be related to an obstruction to the gallbladder. It's an organ below the liver. It might be
Okay.
obstructed, which may be related to this pain. It may be related to something regarding the pancreas. It's in the same site. So we need to do further tests in order to exclude all of this. What do you think?
All right. Okay.
All right. So is there anything I can help you with?
No, just tell me what are they going to do in the hospital then?
Well, they will gonna do some bloods to know if there is anything affected. They will do some other scans, and accordingly they will involve with a specialist.
Move on to the next station.
Hands up. Thank you, Dr. Omar. How do you feel?
Not a clue. I try to exclude any infection, anything, but alcohol, but everything is negative.
Okay. All right. I'm happy that you didn't send the patient home. Okay.
Yes, I know. Yes, at least be safe. Yeah.
Okay. At least you were safe. Okay. But I was just telling myself there's something that you didn't think about at all.
What, the MI or what? Yes. Mhm.
All right. I'm happy that I've done the case with you. Okay. Your exam is soon, inshallah. And I did want to do this case with you, just for you to be prepared for, to rearrange your thinking about the emergency situations. Okay. I'm happy that you didn't send the patient home, which is really good. Okay. But I would love if you just thought about MI or perforated ulcer,
Okay.
right?
So
Okay.
if it's related to perforated ulcer, should the alcohol history be positive? You drink a lot of alcohol.
Not necessary. Maybe he's taking non-steroidal anti-inflammatory drugs. Maybe he has gastroesophageal reflux disease and it's not diagnosed before and caused this ulcer. You don't know, okay? But
Okay.
at least think about the common. Common is common, okay?
Hmm.
So in this case, what do you think that you need to do in terms of the investigations in the GP?
The ECG, because it's MI, yes. And I think I didn't ask more about the chest pain. You mentioned from the first point that there
This
is
is
chest
the
pain. I
second point
ignored
that I
this.
would, yeah,
Yes.
this is the second point that I was supposed to talk about, okay? So the first thing, you didn't ask for ECG. If you ask me about ECG, I would give you this one.
Okay.
What is this one?
There is an ST elevation in the V3, V6, right?
No ST elevation. Where? V6?
Normal. I don't know.
No, it's very
V3.
mild. It's just V3.
Yes.
No, even if you can see the junction,
Okay.
this is the junction. It's not. Can you see
Okay.
that? It's not elevation. Okay, it's normal ECG. Okay, normal ECG, but you cannot roll out MI.
Yes.
It could be non-ST elevation MI. Okay, the pain is sudden. All right, so you have to be minded by the duration, the onset, the duration, and the character of the pain. You didn't explore the pain. Okay. You asked me where is the pain exactly, but you didn't ask me, is it going anywhere? You asked me late. Okay. Does it go anywhere else? How can you describe this pain? How bad is the pain? Okay, so full exploration of the pain. Always, doctors, always, when you have a symptom, specifically pain, explore the pain very well. You will be able to reach 40–50% of the diagnosis. Okay, the pain is in the epigastrium and the upper chest, going to the neck. The pain is sudden and it's increasing. If you ask me how bad, how can you describe the pain? It's something on my chest, doctor. Okay.
Okay.
What else? How bad is the pain? I would say 7 or 8. Okay. So these are the character of the pain. Sudden, going to the neck. Then I have to be aware of emergency. What could be emergency in this situation? In epigastrium and upper chest, acute MI, and the ECG is normal, non-ST elevation MI. This is the first thing that you have to think about. Secondly, anything in the stomach, maybe perforated ulcer, or what else? Severe inflammation, severe gastritis can cause that. Severe, okay. It could be pancreatitis. It could be, but it's you know, a little bit far away from the character of the pain. The pancreatitis is band-like pain, which is gradiating to the back. The patient doesn't have any history of alcohol or gallstone or anything that can suggest of, but you have to think about it as well. All right. So these are the differentials. There is something serious going on with this patient. We don't know what is it. So you tell him, you tell him your thoughts. I'm concerned this could be coming from your heart or coming from your stomach. From your heart, I'm concerned about heart attack. The ECG is normal. Okay, it's reassuring, but we cannot rule out a type of heart attack with normal ECG. The other thing is your stomach. You could be having severe inflammation in your stomach or ulcer in your stomach causing this severe pain. And all of these are emergency. We need to be safe. And you should be going to the hospital right now. I'm going to send the ambulance to come and take you to the hospital. We will closely monitor you until the ambulance comes. What will happen in the hospital, doctor? They will assess you again. They will do further investigations in terms of heart attack markers, in terms of some markers in your blood to check if you have any problem in any organ in your tummy. They also might do X-ray on your tummy to check if there's any perforation or not. So heart attack markers, X-ray, and amylase, and you know, the markers of pancreas. Okay. Are you going to give anything to this patient? So the patient will go to the hospital, and you told him what will happen in the hospital: bloods and imaging. Bloods, heart attack markers, and some basic bloods. Imaging, X-ray on the abdomen. Okay. This is in the hospital. Are you going to do anything with this patient until he goes to the hospital?
I've mentioned only the medication for the pain.
Yeah, pain.
Yes, something appropriate to
painkillers.
the level of the pain.
So you didn't ask me how bad is the pain, so please
Yes.
do ask and give me the pain which is appropriate. If it's 7 or 8, give morphine. You can give morphine to this patient. It's fine. Okay.
Okay.
What else?
Aspirin may save his life if he
Yeah,
uses an
good,
MI, and
good.
may cause more bleeding if this is a perforated ulcer.
So yeah, this is something that you have to weigh, weigh the benefits and risks. Okay, the patient doesn't have any abdominal symptom, very severe. Yeah, I mean tenderness or no bleeding, no melena, no vomiting of blood.
And no signs of acute abdomen. Yeah.
Yeah, no peritonitis, no rigid abdomen, nothing that can make you very suspicious of acute bleeding in the abdomen, but you have to weigh benefits and risks. Give aspirin because most probably this is something in the chest. Okay? You can tell the patient smartly, we might need to give you aspirin, but I'm going to discuss that with the consultant. Okay? And the consultant will be able to tell you, all right, let's weigh benefits and risks, give aspirin or not. All right, but at least mention that. This is how you, inform the patient about what are you thinking about. We might need to do that, but in this case, you will involve the consultant, but you will involve the consultant smartly. Okay? Do not tell the patient, well, I'm not sure what's going on. I'm going to tell my consultant and the senior will come and examine you and assess you. We need to take a second opinion and then we can take it from there. No. You should be able to tell the patient what are you thinking about, what you are thinking about, and what is the most probable sequence of steps. All right? Okay, doctors? So I'm happy that we've done this case. What you need to think about, just give me a second, doctors. So if I give you a comment about what you need to think about in your performance, Dr. Omar, explore the pain very well, okay? Please do not miss exploration of any symptom very well. Be minded that epigastric pain can be cardiac, sudden, okay? Any epigastric pain, please do not miss asking for ECG. Yeah. What else? Lastly, do not send the patient home if you think that this is, even if the patient is stable, but the character of the pain is concerning. Don't send the patient home and monitor the patient. Okay, so I'm concerned about the character of the pain that you have. This is how you are going to tell the patient the diagnosis. Well, Mr. X, you have this pain with sudden onset. The examinations are not showing anything. The ECG as well is normal, but I'm concerned about the character of the pain. It's sudden and it's severe and it's going to your neck. All of these are concerning signs of the pain. This pain, explain to the patient what you are thinking about. Don't tell the patient what we are going to do with you without telling the patient what the patient has. Please, doctors. Many of the doctors fall in this mistake. They tell the patient what is the next step without telling the patient what's going on. Okay? I'm concerned about this pain. This pain most probably is coming from your heart. It could be heart attack. Okay? It could be coming from your stomach. maybe there is perforation or any severe inflammation causing ulcer perforated in your tummy. We are not sure what is the cause exactly, but these are the two most common causes of this particular pain. All right? Don't worry, you're in safe hands. We are going to do our best to help you. So, do you want to know what will happen? Yes, doctor, please. Okay. So, we are going to send you to the hospital with an ambulance right now. Until the ambulance comes, we will monitor you. We might need to give you aspirin as a, as a treat or as a prophylaxis for the heart attack. I'm going to discuss that with the consultant if we can give you aspirin. Okay. And we will closely monitor you until you go to the hospital. If you have time, would you like to know what will happen in the hospital? Yes, doctor, please. Or if the patient asks what will happen in the hospital, they will do further assessment. They will examine you again or assess you again. They will do further investigations like heart attack markers, some markers in the blood to check your the pancreas function. Imaging on your abdomen to check if there is any perforation or not. Okay. And based on that, they will treat you accordingly. Okay. Yeah. Anything else that you can tell the patient in terms of the management? You can advise the patient to avoid eating or drinking until he goes to the hospital. Okay. There might be a problem in the abdomen and they might do a surgery, okay, or a procedure, endoscopy. We don't know. All right. So this is how to deliver the diagnosis and the management. Clear, doctors? Clear? All right. Let's do the next case. All right. Okay. Who's the next doctors? Dr. Amira, I think. Dr. Amira?
Yes, doctor.
Ready?
Yeah.
Okay. Read your question, please. I'm going to switch my camera off because it's a phone consultation. And just for your knowledge, doctors, in the case that we have discussed, the last one, most probably they will give the patient aspirin. Okay, if we benefit or if we think about the benefits and risks. Okay, but just as a level of FY2, leave it to the consultant.
Begin.
Hello. This is Amira Said, GMC number 1234. Shall I proceed?
Yeah.
Hello. Hello. Am I talking to Jack Halford?
Yes, doctor.
Hello, Jack. This is Dr. Said, one of the doctors calling from the GP.
Yeah, hello.
Yeah, hello. First of all, can you confirm your age?
I'm 60 years old, doctor.
Well, and can you confirm your first line of address?
It's 33 Frederick Drive, 12345.
Okay, so I understand that you wanted this call because you had some blood in urine.
Yes.
So can you tell me more about this?
Um, what do you want to know?
Just give me more information about how did you notice this and when exactly this happened?
Yeah, it's for 10 days now, doctor. I'm passing urine, which is not clear. It's just pinkish in color, and I think there's blood in the urine because of this color.
Okay, this must be very worrying to you. And you noticed this blood at the beginning of the urine or the middle
No, throughout.
throughout? Okay. So 10 days ago and before this, this hasn't never happened?
No,
Okay. Could you think of any triggers, like anything?
nothing. No, doctor.
Okay. And do you have any pain while passing urine?
No,
Okay. Anything make this color disappear or something?
no.
Okay. And is it you told me it's pinkish, correct?
Yeah,
Okay. Does the urine have any specific smell?
no,
Okay. And do you have any tummy pain?
no,
Any back pain?
no,
Any discharge coming from your front passage?
no,
Okay. And do you feel dizzy?
no, doctor.
Any heart racing?
No,
Any tiredness?
no,
Okay. Do you have any lumps anywhere in your body?
no.
Any recent unintentional weight loss?
Well, I would say yes. I lost some weight. But I didn't weigh myself.
Okay. So how did you notice this?
The clothes are getting bigger.
And how's your appetite, Jack?
I don't know, doctor. It's not very good nowadays.
And do you get any night sweats?
No,
Do you have any fever?
no,
Okay, and you told me you don't have any pain in your tummy or your back.
no,
Okay. And regarding your general health, do you have any medical condition?
no,
Do you take any medications?
no,
And do you have any allergies?
no.
And is there anyone in the family? I'm sorry if this is alarming, but it's important question for the consultation. Anyone in the family have been diagnosed with any cancer in the waterworks?
No.
Okay. And moving to your lifestyle, do you smoke?
Yes, I smoke. I'm a heavy smoker, doctor.
Okay. And
Yeah, I
mm,
finish 2 packs every day
since when you have been smoking?
since I was 30.
Okay. And do you drink alcohol?
No.
All right. Um, okay, Jack. So Um, I understand this can be very worrying and concerning. How are you coping with this and how is this affecting you?
Uh, well, I'm just worried about having cancer, doctor. You asked me about cancer history in my family. Is it cancer?
Yeah, I'm sorry if this made you worry and concerned. It's just a routine question, and it's important for the consultation. We can't be sure about anything right now. We need to ask you a few more questions and do some tests to confirm the diagnosis.
Okay.
Okay, so I just want to make sure that you have support around you, Jack, and everything is going well with you.
Yeah. Okay, thank you.
Okay. So you told me you're concerned about cancer. So, ideally, I'd like to examine you. I'd like to check all of your observations, including your blood pressure, heart rate, breathing rate, oxygen level in your body, and temperature. And also, I would like
2
to do
minutes remaining.
a tummy examination and do a urine dipstick to check for any blood. So, I would like you to come to the hospital, as this is quite concerning to me, Jack, as you told me you have this blood in urine and you don't have any pain. Just let me tell you that some types of waterworks cancer can present in the same way. Um, Yeah, we are not sure about this yet. We just need to do more investigations and do ultrasound and some imaging scans on your tummy and pelvis. So we are not sure yet.
Okay.
So how do you feel that you come to the GP that we can order some tests? And we will refer you to the specialist within 2 weeks to discuss with you further management and the investigations that need to be done.
Okay, doctor. No, yes, I can. Yeah.
Okay, so do you have any concern or question at the moment?
Could it be infection, doctor?
Okay, this is actually a valid concern. Some infections can present with blood in urine, but you told me you don't have any pain while passing urine, you don't have any fever or any discharge. However, it can be. We will do more investigations. We will do urine culture and screen for any STIs to make sure it's not an infection.
Okay. What's STIs, doctor?
This is a,
Move on to the next station.
okay.
Right. Thank you, Dr. Amira. Hope you speedy recovery. Do
Thank
you
you.
have what do you have? Just cough or
Cough and flu. Yeah.
Yeah. Hope you speedy recovery, darling.
Thank you, doctor.
Okay. So how do you feel?
I don't know. Just maybe in the management, I didn't say much about any medication. I just don't know what is the diagnosis yet. So I don't want to talk about any chemotherapy, surgery, and those stuff before we diagnose him.
Okay, this is the trick in the question. Okay, that's why I'm telling you that the cases are a little bit tricky today. People just deal with the cases as what they just hear about the case. Okay, we have hematuria. Okay, this is most probably cancer, so I'm going to tell him cancer and do the other investigations and that's it. When we can say cancer or as one diagnosis if you have the urine test and the urine test is excluding that there's no infection. Okay, you didn't even give me a differential.
Yes, I just excluded them from pain, fever, and discharge.
Sometimes infection can just be not symptomatic, right?
Okay.
So just give me, I didn't say, don't say cancer, but at least give me differentials. You you have phone consultation. It's not face-to-face. So they provide you with the urine test. Once you find the urine test negative, then you tell him most probably it's cancer. In this case, it doesn't work like this. Yeah. So you don't have the confirmatory steps to tell the patient most probably this is related to cancer.
Yes.
Got me?
Yeah.
All right. So this what was concerning me in the management. Okay. In history taking, I'm happy with your history taking. You could have asked about clots in the blood, in the urine. But I did say it's pinkish in color. But you can ask me about clotting in the urine, or blood clots. You can ask me about trauma. Have I had any trauma before onset of this? You asked me, is there any specific thing happened? You can specify any trauma before these 10 days. Okay.
Yes.
Travel here is okay to ask. Sometimes hematuria can be caused by, tuberculosis, and tuberculosis can be caused by travel abroad. You can ask about travel here. It's not a problem. These are the points that you missed in the history taking. Okay.
Okay.
But I'm not too concerned, to be honest, I'm not too concerned about the history taking part. All right. You asked me about the present, past, personal, psychosocial. You've covered it all. In terms of the examination, it would be better to tell the patient, well, we would like to see you in the GP to do some assessment, some examination on your tummy and on your private area. We might need to do a test, per-rectal or rectal examination, or examination of your back passage, just to find out what could be the cause of this urine, or this bleeding in urine. Okay. And we will need to do some further investigations, specifically urine test. Okay. So this is how to tell the examination and investigations in phone consultation. Okay.
Okay.
But I'm happy with you. You didn't do something wrong. You told ideally I should do this and this and this. So we would like to see you in the GP. This is not a big problem. Okay, but I'm telling you what is the best idea.
Okay.
Yeah. What I'm concerning about is the management part. So you tell him, well, Mr. X, there are many causes of having blood in urine. One of the causes is infection. By history, I didn't point to a specific symptom cause that point to infection, but we will need to do the urine test that I mentioned, just to exclude or to confirm if you have any infection in your urine causing this, in your waterworks causing this blood in urine. All right. The other thing that I am thinking about, or just to be safe, because your age, you're 60, and I cannot point to a specific cause. If your urine test is negative, sorry, if your urine test is negative, then we will need to exclude other serious causes. Serious causes like what, doctor? Like cancer in the bladder. All right, doctor? All right, Dr. Amira? So,
Yeah.
in this particular case, you cannot say it is cancer.
Yeah.
Are you convinced?
Yes. Should I tell him to come to the GP or go to the
Yeah, you ask him to come to the GP. As I mentioned, you tell him, well, we would like to you to come to the GP for further assessment. We will need to do some examination to your private and your water work as well to find out what could be the cause. And we will need to do further investigations like some bloods and kidney function tests in addition to urine test. This is how to do or to verbalize the examination in this particular case. In the management, again, you tell the patient the differentials. All right. One of the there are many causes. One of the causes is the infection, and we need to do the urine test to rule it out. If the urine test is negative, then we will be concerning about this blood with the age or the age group that you are in, 60. We will need to exclude the serious causes.
So I will tell him that we will run some tests, urine tests and culture and those stuff after we rule out infection and any other causes. If it's unexplained hematuria, we will refer him 2-week referral. All right? Or
yes.
Okay.
All
So we
right.
don't need to arrange ultrasound before the 2-week referral.
Ultrasound for what?
Pelvis.
The ultrasound will be done for what the pelvic ultrasound will show.
If any masses in bladder or
okay. The ultrasound will be done by the specialist.
okay, so just the
Okay.
hematuria that we need, unexplained hematuria that we need for 2-week referral, correct?
Yes, the unexplained one. But here you even didn't have the unexplained part.
Yes, yeah.
You are waiting for the urine test, right?
Yes.
Okay. So you tell him it could be infection, but if the urine test is negative, then we will need to think about some other serious causes.
Okay.
Okay. So this is the thing. You ask the patient to come and you tell him this could be infection. If it turned that this is not infection, we will need to exclude the other serious causes, and we will need to refer you urgently within 2 weeks. Okay?
All right. Okay.
It depends on the situation, doctors. Please do not be scripted just because you learned the case as you learned in any course or any note. Okay? The situation here is different. When I discussed the case before as a face-to-face consultation, the patient had the urine test, the PSA test, the per-rectal examination, everything was reassuring. Then this is unexplained hematuria, right? Then we can confirm this could be something related to cancer. But if we don't have the other pieces of puzzle to complete, then we cannot tell the patient, well, it is cancer without excluding the other common causes. Got it, doctors? Yeah. Dr. Abdurrahman is asking, is it ever appropriate to refer a patient to a specialist without coming into the clinic? In some cases, yes, but we have discussed the case now. We've discussed that the patient will come to the clinic to do the blood tests and the urine test. All right? After the urine test, if it's negative and the patient has 60, no explanation for the hematuria, then you will refer the patient to the specialist. Okay, this is the trick in this case. You do not have all of the pieces of the puzzle. So you cannot tell the patient, well, I'm concerned this is cancer. No, you give differentials. All right, doctors. Got it? Yeah. Okay. Let's do the next case, doctors. Who is ready?
I'm available. I missed my turn because I came on late. It's possible.
Who is that, please?
That's Peter.
Peter. Okay, Dr. Peter. I think yes, Dr. Peter, and then Dr. Muaz. Dr. Muaz did the case.
I'm here, but I didn't do what is left.
All right. And Dr. Ilham, are you here?
Yes, I'm
All
here.
right. So we have Dr. Ilham, Dr. Muaz, and Dr. Peter. Okay. These
Yeah.
are the doctors who are giving their exams soon. Okay.
Yes.
Yeah. Let's do the next case with Dr. Dr. Muaz. Your exam is in which time? Which date?
28th November.
Okay, we will start with Dr. Peter. His exam is 12th of November. Okay.
Okay.
So
No,
Dr. Peter and then Dr. Ilham and then Dr. Muaz. Okay. All right. Read the question, please, Dr. Peter. If you would like to switch your camera on, it's totally fine, Dr. Peter.
I'm more of a shy person.
Shy person? Okay. No worries.
Okay. I don't really remember the theory behind it, but let's have a trial.
Okay. Where is the case? Just give me a second.
Okay.
Is it this one? Um, yeah, got it. Okay. Let's see how much time left. Few seconds and we can start.
Begin.
Hello, it's Peter James, number 1, 2, 3, 4, 5. May I proceed?
Yeah.
Hello, I'm Peter, one of the doctors here in this department. Am I talking to Julia Black?
Yes,
Mrs. Julia
doctor.
Black.
Yeah.
How would you like me to call you today?
Oh, Julia is fine.
All right. Can I confirm your age, please?
I'm 80.
Okay, I understand that you were admitted in the hospital for a while for an infection down there. Is that right?
Yeah, I had an
Yeah.
infection in my waterworks, and
Mm.
yeah, I'm about to go home, doctor.
Yeah, well, that must be very exciting, isn't it?
Yeah, it's very exciting, but I had very bad fall.
Yeah, it's
Yeah.
unfortunate to see what happened. Okay, I'm just here to check up on you and see what really happened. But how was your hospital stay so far? Is everything okay?
Yeah, it was good. It was good, but
Mhm.
yeah, apart from this fall.
Mhm.
Yeah.
And how about your infection? Is everything okay?
Yeah.
Okay, that's good to hear. So would you tell me a bit more about the fall? What happened? Did you by any chance trip?
Yes, most probably I tripped over. I was just going to the toilet and then just tripped and went on the
Mm.
floor on the floor.
So what was the floor slippery? What happened?
No, doctor, I don't know. Maybe my leg gave way. I'm not sure what happened, or just,
That's very unfortunate.
down.
Is everything okay? Did you by any chance hit your head?
No, at all. No, doctor.
Okay, that's good to hear. And before this happens, did you have any heart racing?
No, 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 at all. No,
Any weakness or numbness anywhere?
at all. No,
Yeah. Okay. And when this happened, did you lose consciousness?
no.
All right. And after this happened, did you remember and regain everything very clearly?
Yeah. It's just, I tripped over, doctor. I didn't have any symptom, any problem at all. It's just,
Okay,
yeah.
that's reassuring. And how are you feeling right now? Is there any pain anywhere?
Yeah, I have pain. Yeah, I have pain in my hip. Yes, doctor.
I'm really sorry about that. Is there any swellings or bruises?
I don't know. I didn't see.
Mhm. Okay. We'll check on that as well. So going to your general health, do you have any medical conditions?
No,
Any
no,
medications that you take at the
no,
moment? Okay. No, do you have any specific allergies?
no.
Okay, that seems that you've been through a lot of stuff actually. Having an infection and being discharged and just about getting discharged, you fall down. I know it's difficult,
Yeah.
but I'm here with you to support you throughout this. So let's just hope for the best. Do you have someone with you, or are you here on your own?
Well, my daughter is just coming to pick me up.
Okay, so you've already called her.
Yeah, the nurse called them, called
Oh,
my daughter and told her to come and pick me up.
oh,
Yeah.
all right. Okay, so do you usually independent or do you need help?
No, I'm doing everything by myself.
Okay, that's good to hear. And you're usually mobile?
Yeah.
Okay. So, I would like to examine you. I would like to take your observations real quick, your heart rate, breathing rate, blood pressure, temperature, and oxygen level. And I would like to have a look just at where you fell, and especially your hip, because you said it's painful. Would that be okay with you? We'll maintain your privacy. We'll have a chaperone. So can we proceed?
Yeah.
Okay. Now, before we discuss further, is there any concerns that you have at the moment?
I just need to go home, doctor. Don't tell me that I do have a problem because I want to go home.
I understand. Mhm. Okay, so after examining you, we've just noticed that your right hip, like you said, is a bit tender and it's a bit kind of bit out of the place. So we just want to have another look and order an X-ray to look at the joint and see what's going on, because it's can be a bit concerning to us. So what do you think about that?
What do you mean by concerning, doctor? What are you concerned about?
Well, I'm just worried that the fall may have uh, caused you a dislocation or a fracture. So we need just to do an X-ray to rule out anything serious. I
Oh
know
my
it's a
God,
bummer.
doctor. No, doctor. Uh, it's just some pain in the hip, doctor. Don't tell me that I have a problem, doctor, please. It's, I don't think this is serious, doctor. Please, just let me go home, please.
I can see that you're really upset about this kind of news, and it would be really upsetting if anyone in your place would feel the same way. But your health and your safety is my priority, and this is what we aim for, what we aim for. So, just to make sure that everything is okay, we'll keep you here, keep an eye on you, and make sure that everything's fine. And if there is anything, the orthopedics team would immediately take action, so that we prevent any further complications. What do you think about this?
Well, it's just pain, doctor. It's just pain. Just give me painkiller and everything will be okay.
Uh, of course, we're going to give you painkillers and we'll try to support you throughout this. You'll not be alone. We'll try to make you feel as comfortable as possible. But if there's any fracture, if there is anything, it could lead to very serious
2 minutes
complications. So
remaining.
our best shot here is to call the orthopedics team and do the x-rays and check up on you just to make sure that everything's okay. Would that be okay with you?
So how much will it take?
Well, it really depends on the test results and what the X-ray will show. Let's just hope for the best and see what happens.
So if there's no fractures, can I go home then?
We still have to assess the situation and see if there is any tear, if there is any dislocation, and if there is any complications from that. So I cannot give you any guarantees until we assess this a bit more and do further tests.
All right. Okay.
Well, I'm really sorry once again. I know you're excited about this. We'll give an idea to your daughter. You said she was coming to pick you up, and we'll support you through this. And hopefully things turn out for the best. Is there anything else that worries you at the moment?
No, thank you, doctor.
Have you met your expectations today?
All right. Thank you.
Okay.
You still have time. So how do you feel?
Okay. This was a simple one, I think.
Yeah, it's simple for you. Which is
not
really,
med-
you did the kids very well.
It's
Okay.
not medically related, so that's the easy thing about it. It's the problem is always in the data gathering and the management and the
Yeah.
time differential. So this is
Yeah.
quite clear, straightforward though.
Yeah, it was easy and straightforward, but the trick is in the communication skills. And your communication skills were very, very good. Okay. That's why you felt that it's okay. But with some doctors, they will find that there's a struggle, especially
Uh-huh.
that the patient is old in age and she was excited to go home, and all of the sudden you tell her that there is a fracture and she doesn't think that this is a fracture. She doesn't think that this is serious. So some doctors will struggle with the interpersonal skills, but you did it really good. What if the patient wants to go home despite you telling her?
Well, certainly you're right to decide what's best for you. My job here is to support you either way. I've just explained to you all the possible outcomes and what's medically advisable. In that situation, you just need to sign a form that says that you refuse our medical advice, but that doesn't mean that at any moment you change your mind, you can come back to us. We'll be here free waiting for you.
All right, okay. Yeah, and just ensure that she knows that if she goes home
She can come
with
back
this
anytime.
fracture, this is unsafe. Okay?
Yes.
This is unsafe. So she will not be able to weight bear. Okay, tell her,
Yeah.
okay, you have dislocation, you have fracture, so most probably you will not be able to weight bear, and this is unsafe for you to go home.
Joint erosion could happen, ischemia could happen, and even nerve
Yeah.
tears could also happen. So there are a lot of serious complications.
Yeah. Okay. What I would advise you, just one advice, Dr. Peter. I like your enthusiasm in in dealing with the patient, but sometimes
Empathy.
Empathy. All right, this is one of the thing, and slower speed while you are talking. Okay.
Yeah.
Especially that the patient is 80 years old, she's old age. Okay, so just so you have time. Okay.
It's really not something that I guarantee. The time thing, sometimes it runs and sometimes it doesn't, and I just don't know. Sometimes a lot of times actually the time really runs away. Especially if there is a lot of differentials, I usually get kind of lost and
Yeah.
I don't really have things very well arranged in my brain, so I take some time to think.
Mm-hmm. All right.
And kind of misses the case.
Okay, so I do understand your point of view, but in this case, you had time.
Yeah.
Yeah, so just manage your pace of talking based on the time management, okay? In this case, you had time and the patient is old, so some sympathy and some, just give me a second. This would give more interpersonal skills marks. All right? But yeah, you've done it really well.
Thank you, Doctor.
Okay, all right, right. So let's do the next case. I do not have too much to say in this case with your performance, to be honest. Okay, Dr. Ilham, are you ready?
Yes, doctor. I'm ready.
Okay. Read your question, please.
Recording in progress.
Hello.
No,
Shall I proceed or still have time? I hope still have time.
you still have time, yeah,
Okay.
to read. Is there anything happened?
I just hear the timer.
No.
Begin.
Hello, my name is Ilham. I'm one of the doctor in the hospital. Am I talking to, could you tell me your name?
Doctor, I am Sarah.
Hello, Sarah. Could you tell me what is the relationship with Mrs. Chapman?
She's my mom.
Okay, and could you confirm his age for me, her age for me, please?
She's 78, doctor.
Okay, Sarah. Could you tell me, I can see from my note that she was admitted in the hospital for a while. Could you tell me what happened in the first place?
Oh my God, doctor. She is not eating very well, doctor, and she lost weight. I just need to know, how is she, doctor? Is she fine?
Okay, Sarah, I totally understand your worries about your mom, and that's so kind. I can't agree much that you are worried that she is your mom, but let me know more about her condition, and of course, I will come to that point of telling you everything.
Okay, doctor. All right. So what do you want to know exactly, doctor?
Why she came to the hospital in the first place? Oh, what happened?
She was losing weight, doctor. She doesn't want to eat at all. Even when I cook with the food that she likes, she doesn't eat at all.
Mm.
She lost a lot of her weight recently, so I just decided to bring her to the hospital.
Okay, since when exactly happened all this?
And it was just getting worse in the last month.
Mm. Do you think anything worse in her condition?
I don't know, doctor.
Okay. Does she have any other symptoms at all?
No,
Okay. Do you have any fever?
no,
Any bumps or lumps in her body?
no,
Okay. Does she have lost her consciousness or become confused by any chance?
no,
Okay. Does she complain of any pain in any part of her body?
No,
Okay. Any cough?
no,
Any breathing problem?
no.
Okay. Could you tell me, I can see that she has been diagnosed with dementia, is that right?
Yes, doctor.
How is she coping with it?
Well, the dementia is getting worse. She's
Mm,
totally dependent on me, and
mm.
she doesn't know me, doctor, but I'm trying to do everything that I can.
So you're meaning that her condition become worse with time.
Yes.
Oh. So just want to know about how are you coping with this?
Well, she's my mom. I'm doing everything that I can. I lost my job, to be honest.
Mm.
I'm the only carer looking after her. So yeah,
So do you have any support around you
no,
regarding?
doctor, no,
Okay. Do you have kids at home?
no.
So okay. Do you think what might cause that problem with her?
I don't know. I don't know, doctor.
Any concerns?
I just need to know how she is. She fine, doctor? Is she getting better?
Um, Actually, I will address that shortly. Just let me tell you that all the investigations and blood tests come normal, and she already done everything, and nothing abnormal in her, and she actually can have her fluids and take oral, but it is quite difficult because worsening dementia. Do you understand what I mean?
No, doctor. No, to be honest.
Oh,
You
okay.
told me that everything is normal. So what?
So she
Why
doesn't
is she
have.
losing weight then?
Oh, I see. Dementia in some cases will become worse and with time, make people forget even to eat. Am I clear?
Yeah.
It's the late stage of dementia, I'm afraid.
All
I'm so
right.
sorry to tell you that. And there is nothing to be done to her now regarding her physical or medical point of view, but there is a lot of support regarding keeping her life without suffering in the next days or months coming.
What do you mean nothing to be done from the medical point?
2 minutes remaining.
Are you
I
going
mean,
to leave her like this, doctor?
not like that, but there is no abnormality with her body. There is no abnormality in her chest or tummy. Just that we need to keep her quality of life better as much as we can by we can involve the palliative care team. It's a care team that is specialized in such cases of dementia, which has become worse and with time. They have lots of support for her. They start to give her support regarding her diet. Can help you regarding care. They also who also can give you a carer help that help you regarding this, as you've mentioned that you're struggling a lot with that and you've lost your job. So I think you need the help, Sarah.
Okay, doctor. So can you give her any food through her tummy?
Actually, she can tolerate only fluid, but we actually the late stage, Sarah. I'm afraid we can't even feed her forcibly, as it might cause more stress and might increase her condition deterioration.
Yeah, I've heard about something called tube, nasogastric tube, where
Oh,
people can
yes.
people
Actually,
can
we
just
can't. We can't, Sarah. It is rough to do this to her. She is very weak at the moment. She can't tolerate that thing that comes through her mouth or nose to her stomach.
Move on to the next station.
Time's up. Thank you, Dr. Ilham. How do you feel?
Still have some things to tell her, like care. I said about care, but I think there are points like pain medication to make him comfortable, sedations and like midazolam maybe.
Okay.
I see that I should tell her more about how we can help her regarding her mom. Might be I told her about that thing, but in shortly. So I should have explained it more.
Okay. All right. And why do you think that you didn't have time to explain all of that?
I don't know.
Any idea?
Maybe I did ask more questions in the gathering. Much question?
That's correct. That's correct. You did ask too many questions which are not relevant to the situation. Why they are irrelevant? Well, they've written everything about the patient here, right?
Mm.
The patient has dementia, all investigations, including blood tests, ECG, X-ray, ultrasound, CT scan, abdomen, all are normal.
Begin.
Patient has been given some
Mm.
fluids and she is able to tolerate a bit now. So she's able to take sips of water. She's on palliative care now. Multidisciplinary team has decided that the weight loss is only due to dementia. So everything is written about the patient. You asked me about cough, fever, and since when, for how long.
I did explore weight loss, but I didn't explore any other symptom, just weight loss.
Why do you want to explore the weight loss?
I've heard that even if I have all the information that ask, I'm not sure. I have to ask the patient. I heard it somewhere, but I'm not sure of that.
All right. Okay. You heard it somewhere. Right. Let's say that you've heard it somewhere. Let's think about it logically. Okay? Let's think about it logically. The patient, medically, nothing is there. All right? They've written in the question, the weight loss is only due to dementia. Okay? They've given you everything to help you just to explain the situation to the patient. What is your task? Explain the mother present health status, discuss the further plan of management, and address her concerns. So you have to explain that everything is normal and the weight loss is only due to dementia. You explain dementia and you discuss the further plan. What is the further plan? Palliative care. Okay? If you don't talk, some people don't talk about palliative care at all. All right? So it was good that you explained palliative care and this is the further step of management. Okay? And address her concerns. She has some concerns, some questions, you answer them. Okay? You didn't have time to talk about the situation exactly. I mean, the comfort feeding and what should be done at home if she's going to take her home, the help that you should provide her in terms of the NHS package for the dementia patients. Okay, you didn't talk about that at all. All right.
So what are the markers of data gathering? How can I do data gathering part?
Nothing. How much do you know about your mother condition? This is the only question.
Okay.
This is the
Okay,
only thing
thank
in
you.
the data gathering. And think about it. If you are asking about the weight loss, for how long? And is there any fever, any cough, any blah, any blah, any blah? Will this help you at
No.
all
No,
in the management?
no, you're right. Yes. No.
Okay, so we have to think before we hear from others, okay? We have to think about the situation logically. If someone tells you something, it's okay. I understand that, but where is the logic thinking? Where is the logic in this case? If I'm going to ask about the weight loss, what will happen in the management? Is there any change in the management? No.
No.
The palliative care has been decided. The patient is already deteriorating, and the weight loss is only due to dementia. Okay? So do not dwell on something that will not help you at all. Just give me a second, doctors. Sorry, doctors. Okay. So, do you agree with me, Dr. Ilham?
Yes, of course. Yeah.
Okay. So please, please, please think about the situation before you ask and gather your data. Find, well, are these data going to help me in the situation? Are they relevant to the situation here? If they are not relevant, then why do I need to ask about the weight loss and take the history and these things? They're not going to help me, okay? And they will take time from me, from the time that is needed for my task, okay? So I did something irrelevant and I didn't give time to the relevant thing. Definitely you will have low marks in the case. And to be honest, they are going to give you very, very low mark if you are going to do this performance in this case. Okay? Please don't take me wrong. I'm trying to help, okay?
No, no,
Just
it's
trying
okay.
to give you or to tell you what are the mistakes and how to improve them. Okay, so in this particular case, everything is written. You tell her, all right, I'm here to help. I'm going to update you about your mother's condition. How much do you know about her exactly? I know this and this and this. Well, okay, all right. Even asking about the medical conditions here, the past history is not important.
Okay.
All right?
Okay.
Will it help?
Yes, of course. Thank you.
No. Will it help asking about the past medical history? No. All right? They are not going to help because everything has been done to the patient. Everything has been decided. So no need to take more history which are not relevant. Okay? How much do you know about your mother's condition? And then you move on to the psychosocial part. This is the only thing which is relevant in the history taking part after asking how much do you know. So what is my data gathering in this case? The psychosocial part, doctors. What is my data gathering in this case? How much do you know? And the psychosocial part. Okay, psychosocial, by that I mean in terms of is she dependent or not? Is she doing everything by herself? Is she totally dependent on you? Are there any carers involved in her care? You told me that you lost your job. So are you managing financially? Do you need any help? Anything that we can help you with? We have many, many options to help you with. Yes, doctor, please. And then talk about that in the management. All right. So this is your data gathering. In this particular case, again, in this particular case, again, in this particular case, in this particular question, in this particular situation. Okay? And I think you've learned today that there are different situations and different contexts for the same question. All right? In haematuria, the patient was on the phone. Okay, on the phone. No, I need to do further investigations. Then I can tell the patient, well, this could be cancer. I cannot tell the patient you have cancer just over the phone. Unless if there is no investigations to be done, like skin cancer. Okay? If there is a mole increasing or ulcer increasing, the wound is increasing, bleeding, signs of cancer from the history, you can't tell the patient this is cancer because no further investigation can be done. You can tell the patient, okay, I can bring, if you can come to us and do some test by a specific instrument called dermoscopy, this will help, but I am concerned about the character of this ulcer or the character of this mole. This could be something serious. So always think about the situation and the context of the symptom, okay? So in the management, what are you going to tell the patient? Well, okay, Mrs. X or Sarah, well, Sarah, I can see how you are concerned about your mom. To be honest with you, the dementia is getting worse, and the cause of losing weight in her situation is due to dementia. Dementia? Why doctor is she losing weight while is having dementia? Tell her, well, okay, sometimes dementia can affect the appetite, can affect the patient ability to eat. The patient forget sometimes to eat. Even the ability to move the mouth and swallow, and the process of eating itself is very difficult in late stage. So that's why she's losing weight. She doesn't eat very well. Because of that, she's losing weight. And just to be aware that because the condition is getting worse, the best thing that we can do for her is putting her on something called palliative care. Have you ever heard about this before? Okay, so this is how to say it better. You told me, Dr. Ilham, from medical point of view, nothing to be done for her. It's correct. It's correct, to be honest. But we cannot say that to the patient. Got me, Dr. Ilham?
Yes, yes. I
Yeah?
was hesitant while saying this.
Yeah. Okay. So we have to be more sympathetic and just choose our way to tell the patient, well, we cannot do anything for that patient, but you know, sympathetically and sensitively. All right. You tell her, well, the best thing for her now, because her condition is very, very deteriorating. She's frail, she's very weak, and the only thing that can benefit her is something called palliative care. What's palliative care, doctor? Sometimes she tells you, palliative care, I've heard that this is the end of life care. Is she dying, doctor? Is she dying? Then you tell her, well, okay, I do understand where are you coming from. Well, we cannot tell exactly is she dying or not, but her condition is terminal. And usually we put palliative care for patients who are having terminal stages of the medical conditions. It's not necessary to be end of life, but we can give palliative care for patients who are having terminal stages of chronic medical conditions. This will support them. It's a kind of holistic care in which that the patient will be looked after in terms of their their hygiene, and also taking care of them if they have any pain or any symptoms bothering them. We look after them and give them the appropriate treatment. Okay, doctor. So can you give her any NG tube or any medication or anything that can be taken through the stomach? You tell her, well, okay, I do understand that. But in her case, as I mentioned, she's very weak, and everything, if we do anything for her, like what you said, it would be stressful on her. We will put more stress on her, and we don't want that to happen. Okay. Can I take her home? Yes, you can take her home, but we will need to talk about how you can take her home, because you don't have carers looking after her, and her condition is terminal. You will need support in looking after her. So let's talk about how can we help you. You can ask for carers. We can send her in a care home. We can also support you financially. No, doctor, I don't want her to go to any care home. Okay, no worries. You can take her home, and we can provide you with some carers. And they will be able to help you in looking after her. Meanwhile, she can just tolerate sips of water. What we advise you to do at home is something called comfort feeding. And I can give you leaflets about this kind or this type of feeding, so you will be able to help her at home. Okay? So sometimes you will not be having time to talk about comfort feeding. You highlight that there's something called comfort feeding, and I can give you leaflets about this. So always, doctors, please think about what are the most important things to be included in the management, and how I manage my time based on that. If I have time to explain comfort feeding, okay, I explain comfort feeding. If I don't have time, then I will highlight and I'll give leaflets to the patient. Okay? So in the management, again, the last thing in the management in this case, you have to explain to the patient the situation of the patient, and why is the patient losing weight if you didn't explain why the patient is losing weight. Tell the patient about the palliative care, please. All right? And explain to the patient that this patient needs help, okay? Needs support. And lastly, talk about the comfort feeding. In some cases, the patient tells you, okay, doctor, you are not going to give her any tube or anything to support her. So how can I support my mom at home? This is her concern. If this is her concern, then you will need to talk about comfort feeding. All right? So all depends on the concern of the relative. If the patient is concerned about a specific thing, then you will take time to talk about this concern. If the patient is not concerned about feeding the mother at home, then you will highlight and give leaflets. Okay, doctors? Did you understand this case, doctors, please? Because this is one of the tricky cases for many doctors. They don't know how to deal with the case. Dr. Yumna is asking, so if I have info in the question, I should deal with them as known. What do you mean, Dr. Yumna? Do you mean that if you have information in the question, you can use them and you can just deal with the case as yes, you know. It's an information given to you, so you know. You don't need to ask about them if it's well known in the question. I didn't get what you mean exactly. Do you mean by the weight loss? You mean like you know from the question that the weight loss is due to dementia, so I don't need to explore the weight loss, right? This is what you mean? If this is what you mean, yes. The answer is yes. If in the question the cause of the symptom is known, you don't need to explore more about the symptom. Okay? It's the same as the confusion case, the first case that we've done. All right? The confusion is known for you that this is due to hyponatremia. So I don't need to dwell on the other causes of confusion. Okay, doctors? If I did answer your question, please say yes. Let's do the last case. Dr. Muaz.
Yeah, I'm here.
You're here. All right. Okay, so I did answer your question. All right, read your question, please, Dr. Muaz.
Excuse me, doctor. Could you tell me again what's comfort feeding in this particular scenario? Isn't comfort feeding is to feed someone whatever they like, whatever they enjoy, and if the patient is
Yeah.
terminal, they're not capable of eating.
Well, you can tell the patient, well, you can give her some puree food, all right? Just some small spoons from the food, and always remind her to swallow. If she cannot eat, then she cannot eat.
Okay.
All
So
right?
if this is regarding her concern, why you didn't give her a feeding tube. So if she can't eat, then how would I offer comfort feeding?
So how is she going to feed her at home?
That's the thing. She will not be able to feed her at home, and she
If
cannot
she's
take her.
not, okay, you can ask.
If she cannot feed her at home, if she's terminal, then it wouldn't be. It would be just a liability and a burden to send her home with her.
Well, okay. So the patient, she's on palliative care, all right? She's taking all of the medications, the palliative care medications, okay? The comfort feeding is just a type of feeding. You can use this for the patient if they can eat. If they cannot, then they cannot. You cannot force her, all right? So you tell her, you try to feed your mom in a kind of comfort feeding. If she cannot, then she cannot.
Okay. All right. This case regarding her taking her home. So would I let her take her mom home?
Yeah. She can take her mom home and take the palliative care at home. Yeah.
So take the palliative care. I don't understand. So she can take the team. So she
No,
can.
not the team. Not the team.
Would she
Well,
be paid visits at home? I don't
okay.
understand.
No, it's fine. It's fine. It's totally fine. It's okay to not to know about the system. Okay.
We can offer her some social service care and visits from the nurse and the GP. Is this
Yeah.
right?
All right. So palliative care is a team, okay? And there is a department for the palliative care in the hospital, okay? Palliative care can be given either in the hospital or in the hospice or in homes, in houses, okay? The palliative care means a care in terms of medications or some thing to be done to the patient, like moving the patient up and down or to the sides and looking after their mouth and these things, and joints, moving the joints and these things. All of these can be done at home. The nurses can go to the house, all right, in specific times, during the day, okay? And give the palliative care to the patient, and in terms of moving the patient and looking after their joints and cleaning and everything, and the medication can be given subcutaneous. It's not a problem. It can be given at home.
Okay, all right, I get it.
Got it?
Yes, yes. Thank you very much.
All right, it's fine. It's totally fine. I'm happy that you asked this question, because many people just know that palliative care means that the patient will be in the hospital. No, it's not necessary to be in the hospital. Okay, it can be given in the hospital or hospice or at home based on the patient's situation. Okay.
All right.
Yeah. All right. Any other question? Did I answer your question, Dr. Peter, or who is
Yeah,
asking?
doctor, yes. Thank you very
Okay.
much.
Did I answer your question?
Yes, yes, yes. It's
All
very
right. Okay, good. All right, let's do the last case, Dr. Muaz.
Yeah.
Yeah, read your question, please.
Begin.
Hello, this is Dr. Shishin, one of the doctors here in the medicine department. Am I talking to Mrs. Lena Ali?
Yes.
Hello, can you confirm your age for me, please?
I'm 30 years old, doctor.
Okay, and Lena, I understand from my notes that you are here, you was in the emergency department with abdominal tummy pain and feeling sickness. Am I right?
Yes.
Okay, and could you tell me how are you feeling now?
I'm feeling better, doctor, and I want to go home, please.
Okay, I'm glad to hear this. Lena, I am here to explain everything to you, your condition and your blood test, and to help you to make the better decision for your health and your life. Are you okay with this?
What do you mean by better decision, doctor? I can decide by myself. I am
Yeah,
okay.
yeah.
I feel fine.
I can see this. Okay. For better understanding, can I ask you some questions?
Okay.
Okay. When these symptoms started with you?
It started in the morning, doctor.
Okay, I can see. Do you feel that there is any trigger for it?
It's just I was just dropping my children off, and then after that I felt this tummy pain and feeling sick, and I called the ambulance.
Okay. Did you vomit?
Yeah.
No. Okay. Regarding the tummy pain, where is exactly the pain?
It was in the tummy, all of the tummy.
Okay. Can you describe it?
Well, I don't know. It was just, aching.
Okay, I can see. Do you have any fever,
Fever. No,
any cough,
no.
any pain during passing urine?
Well, I feel some burning sensation, yes, while passing urine.
Okay. From when this started?
3 days ago.
Okay. Did you take anything for it?
No,
Okay, I can see. So do you have any bowel changes?
no.
Okay, I can see. So Lena, from my notes, I understand that you have diabetes. Am I right?
Yes.
For how long do you have diabetes?
Um, for a long time, doctor.
Okay,
Few.
and which medication are you taking for it?
I'm taking insulin.
Okay, you take it as prescribed?
Yes.
And you take it today? The dose of today?
Um, well, no, I didn't take the dose for 5 days.
Or 5 days, yeah. Can I ask you why?
Well, I usually take my medication, as I mentioned, but for 5 days I was just busy doing many things, and I didn't remember to take the medication.
Yeah, I can see that it was stressful for you. Taking care of the children, is this maybe stressful thing? How you are coping with this?
I'm coping okay, I'm managing, doctor, but I just need to go home, please.
Okay, I can see this. Can you tell me why you are want to go home specifically?
My children at school, and I'm about to pick them up. It's just half an hour to
Okay,
pick them up, and I'm afraid of I'll run out of time. I'll not
yeah,
be able to pick them up.
I can see. Is there any other person can pick them up, like your partner or something?
No, I'm a single mom.
Mm, okay, I can see. So what are you doing for life?
I'm a housewife.
Okay, I can see. Lena, I understand that you was here because these symptoms, the tummy pain and the sickness, and you done blood tests in the emergency department, and the doctor give you some medications. Is there any doctor explain to you the blood tests or your condition?
No,
Okay, I can see. So I have your blood tests. Would you mind if I speak with you regarding them?
no, doctor. I feel fine. I just need to go home.
Okay, I can see. So, uh, do, uh, do you have any mind that
2 minutes
if
remaining.
we have some chat about the blood tests?
No, I don't want to know anything. I'm feeling fine. Just let me go home.
Okay, I can see. Can you bear with me just for 2 or 3 minutes to explain everything to you?
No, doctor.
Okay, I can see. So, just as I told you, I am not here for convincing you with anything. I just wanted to explain everything to you and to help you to take the better decision.
Okay. So I know
Okay.
what is the best for me. The best for me is going home, please.
Okay, I can see. But you were here and you have some we take some bloods for you for testing them. Uh, do you have any curiosity to know the blood results?
No.
Okay, I guess. So, Can I ask you just one question?
Mhm.
What about your mood today? Do you have anything
My mood is
make you
okay,
feel
doctor. My mood is
okay?
okay. I just need to go home. I just need to
Okay.
bring my children.
Okay. Can I offer you that any one of the emergency social carers, social service can pick them up?
Is that applicable?
Yeah, it's applicable. We can help you for this.
Okay.
Okay.
Move on to the next
Okay.
station.
Time's up. Thank you.
Okay.
Thank you, Dr. Maaz. How do
Okay.
you feel?
I didn't expect that she would be this reluctant. So I took two time in data gathering regarding the symptoms and the diabetes.
Okay. So that this is the trick in the cases, because people just try to preoccupy their mind by a specific scenario. If things went away from what they think, they just get stuck and they don't know how to deal with the case.
Okay, but it seems that she don't know anything about her condition. So we just need few minutes to explore more.
Okay. And how to deal in this situation? She tells you from the start, my children. Then address that fully, then she will be able to listen to you. Okay?
Okay, I can see. I can see.
All right. So this is the trick in ethics cases. In ethics cases, once you see that the patient doesn't want to listen to you and he has a concern, address the concern, and then the patient will be able to listen to you.
Begin.
Once you tell me, well, okay, I can see that you are concerned about your children, and this is very concerning. I know that. Okay, don't worry. We are not going to take too much time from you. Is there anyone can look after them? No, doctor. Well, okay, I do understand that. Well, no one at all? No, doctor. Okay, don't worry. We are going to help you with regards your children. Okay, but my concern now is your health. If you go to pick your children up while having this problem, you will not be able to look after them. Okay, your children, we will be able to help you in terms of picking them up. We can talk to the school or provide any one from the social services, whatever solution that you can say to the patient, but just let her able to listen to you. Okay, show her the sympathy and empathy and understanding that this is a valid concern. Tell her, I know that this is important for you. These are your children, and we will find a solution for you regarding your children. Do not worry about your children at all. Okay?
Okay. I realized it a little bit later.
Yeah. All right. So this is the thing. It can happen. Okay?
Okay.
And people don't pass these cases because of that. All right?
No.
They know the case and they know how to deal with the patient what in terms of the medical management, but they don't know how to deal with the patient in terms of the interpersonal skills. Okay?
Okay, but here he firstly bear with me for the questions, for the symptoms, for the social life, for the medical history. But regarding the blood test, she was very reluctant.
Yeah, yeah. Because she has a concern and you didn't fully address this concern.
Okay.
Okay? All right? And it happens. it happens in real life as well. All right.
Okay.
So address the concern. If she didn't want, despite telling her, don't worry about your children, we will have a solution for them. If she's still insisting, then you tell her, well, what is her name? Well, Lena, I'm concerned about what you have. Do you know what you have exactly?
Okay.
All right.
So
Then
addressing or acknowledge the problem or the concern exactly alone is not enough. We should find a solution also.
yeah. Well, okay, it depends on the patient's situation. In this case, the patient doesn't listen to you. Doesn't listen to you.
Okay.
She doesn't want to listen to you. Then you will need to fully complete addressing the concern with her and let her reassured about her children. Once you let her reassured
Okay.
about her children, she will be able to listen to you.
Okay. Okay.
All right? It depends. In this case, in this particular case, I was not happy to listen to you at all. Okay? So address my concern. If you addressed my concern and she is still unhappy or she doesn't want to listen, then you tell her the situation. I'm concerned about what you have. If you would like, you can tell her, well, okay, if you don't want to go deep in the social service and these things, you can tell her, well, okay, I do understand that your children are important for you, and this is a valid concern. This is a totally valid concern. Don't worry about your children. We will have a solution for them, but I am concerned about what you have. Do you know what you have, Alina?
Okay. Sentences like your health is our priority or something like this would be make her more reluctant or would be helpful.
Will make her more reluctant in some situations, in this case.
Okay.
Okay? If she doesn't want to listen, then she doesn't want to listen. Okay? And the task is what? Discuss initial management with her. They didn't tell you discuss or explain the results.
Okay.
All right?
We can if I address the concern and give her a solution and she insisted for refusal, can we reach it to the DAMA thing or I keep trying to convince I keep trying. I know that I am not my work that convince the patient with anything. And as I told her that I'm here for explaining the result and her condition. So when we go to the DAMA thing,
The what?
DAMA, discharge against the medical advice.
Okay. All right. So yeah, you can reach this discharge against medical advice in this case. It can happen.
Okay.
If she doesn't want to listen, then she doesn't want to listen. But you have to ensure that this patient understands that she has DKA, which is a serious complication of diabetes mellitus, and this could be life-threatening. Once you tell her that, and she tells you, I want to go home, despite telling her that, then you can discharge her against medical advice. It's totally
Okay.
fine.
So if we reach it to this point, I told her that I will discuss with my senior and arrange for her discharge. Okay.
Yeah, you can. Yes, you can discharge her. All right. But again, Dr. Muaz, again, you didn't tell me what do I have.
Okay, I know because she refused to listen.
All right. Okay. So in this situation, if I'm trying to be just reluctant, okay, I will do that with the patient. What I'm going to do? All right. my children, okay, don't worry. I know that this is your concern and it's totally understandable. Your children are important for us as well as for you. Okay? So
Okay.
don't worry about them. We are going to find a solution for them. Okay? But my concern now is you to know about your condition because this is serious. Okay?
Okay. Okay. Thank
All
you.
right. So you have, Mrs. X, you have a serious complication of the diabetes. You didn't take the medication for 5 days. You have developed a serious complication called diabetic ketoacidosis, and this condition can be life-threatening. If we didn't deal with it right now, if we didn't keep you in the hospital to control your blood sugar, this will be leading to serious complications and can be life-threatening. Okay?
Okay. Thank you, Dr.
If you
Sahar.
tell her that, and she's insisting, then discharge against medical advice. But you've done everything. You tried to address her concerns. You told her that what she has and what will happen if she goes home. Despite that, she understands. She knows the benefits and risks, and she wants to go home. She can go home. No pressure at all. Okay?
Okay, Dr. Sahar. Thank you.
All right. Thank you, Dr. Maaz. So doctors, again, in this case, please, please, please. It's not about exploring the abdominal pain at all. Okay? It's known that this is DKA. And the abdominal pain is due to DKA. It's due to diabetic ketoacidosis. All right? You can tell her, how is the pain now? And that's it. How's the pain now? And that's it. Okay? Do you still feel sick? No, doctor. All right? This is in terms of the present history. Okay? What else that you can ask in the present history? The possible causes of diabetic ketoacidosis. Infection, stress, pregnancy. Okay? If the patient is feeling thirsty as a kind of, dehydration, severe dehydration. These are the things that you can ask about in your history taking. Okay, doctors? All right, this is your present history. Yeah, your management will be going around. What else? What else can cause diabetic ketoacidosis? Medication compliance. Okay? So infection, pregnancy, stress, and medication compliance. The patient doesn't take her medication. You will talk about that in the management. What if the patient is telling you, I want to go home from the start? You tell her, well, I can see how you want to go home. Is everything all right at home? Is everything all right at home? I want to go home because of my children. Well, okay, I do understand that. Don't worry about your children. We will try our best to ensure that they are safe, okay? And we will find solutions for that. But what I'm concerned about is your condition. Okay? If she's keeping telling you, my children, tell her, well, okay, is there anyone can look after them? No, doctor. All right, don't worry. We will find a solution. We might find someone to look after them, or we can talk to the school. They can arrange their arrangements, and don't worry, your children will be safe. Okay? If you want to tell her about the social service, it's totally fine. It's fine. No worries. Okay? If she's still insisting after all of that, you tell her, well, okay, I do understand that you are concerned about your children, but I am concerned about what you have. You have is a serious complication of diabetes. And if we didn't treat it, You might not be able to look after your children. Do you understand that, Elena? All right. Okay. Your task is not explaining the test results. If you have time and the patient is happy to hear, she's not insisting, then you will have time to explain to her what is the investigations and what is the situation, and then you tell her we will need to admit you, give you fluids, and give you insulin and glucose and monitoring you and all of these. If she's insisting and you don't have time, this is not your task. Your task is ensuring that this patient understands that she has diabetes, and if she goes home, this will be life-threatening. Okay, doctors? I was very hard, yes, and it happens. It happens, wallahi. Either in the exam or in the real life. Okay? You will deal with many patients who are refusing till they die. All right? So you should be able to deal with them correctly. All right? And alhamdulillah, I do have a good interpersonal skills with the patients. The patients are, I didn't have any complaint from any patient. Every patient who I'm dealing with is just happy, even if they are refusing. Okay? So interpersonal skills are important. Okay, it's not only the medical part. Yes, medical part is important, but interpersonal. If you don't have the interpersonal skills, you will not be able to deal with the management or the medical part. All right. Okay, sorry, Dr. Muaz, I was very harsh, but this will train you on the hard situations. So in the exam, you will just you tell yourself, okay, I dealt with the most difficult situation. So in the exam, you will be able to deal with the case correctly, inshallah. All right. Any question before we end the session? Okay, no worries, Dr. Muaz. But I hope that you reached the point that you know how to deal with this specific case in terms of very reluctant patient. Okay? So if you feel that the patient doesn't listen to you, so there is a concern. Try to talk about the concern, try to acknowledge that I can see that it is important for you, and your body language and your tone of voice will help you in that. Okay? I do understand that. It's very important for you. I know that. And it's important for us as well. Okay? Don't worry about your children. Your children will be fine, and we find a solution to make sure that they are safe, and there's somebody to look after them. All right? But my concern is your situation now. You have this and this and this. And most probably, because you didn't take your medication for 5 days, also you might have an infection going in your body. We will need to do further investigations to find what is the infection that causing this complication. This could be due to urinary tract infection, as you have burning sensation. Okay? So it depends on how to explain, depends on the situation of the case. All right? So if we are going to deal medically or explain to the patient DKA in this particular case, how are you going to explain, Dr. Muaz, or any one of you doctors? This patient has diabetic ketoacidosis, okay, acidosis, glucose is 30, okay, urine tests showing leukocyte, ketones, and protein. She might be getting into nephropathy. Nitrates is negative. This doesn't exclude urinary tract infection. Negative nitrates doesn't exclude urinary tract infection. Okay, she might be having urinary tract infection with one of the organisms. Okay, so you will need to do culture. All right. Her white BCs are high, and neutrophil 7. So the full blood count is showing signs of infection. Okay, this infection could be urinary tract infection, could be something else. All right, so you have diabetic ketoacidosis, which is a complication or a serious complication from diabetes. Most probably, the cause is that you didn't take your insulin for 5 days, and also your results or your blood showing that you have an infection. It could be urinary tract infection, it could be something else. So we will need to keep you in the hospital, do the further investigations, keep monitoring you, giving you fluids and insulin, and at some point we will introduce glucose, but you will need to be monitored. Okay, and if you have time, you can talk about the the medication compliance, if you have time. Okay, I think we can do the case in the next mock. I will do it with you. I can do it now, but we have only 8 doctors. We can do this case in the next mock together. Me as a doctor. Are you happy with that, doctors?
Of course, Dr. Saha,
Okay,
this
no
will
worries.
be very helpful.
All right, no worries. We can do it. So one of you just be the role player, and I'm going to be the doctor, and we can do the case together. And you can be reluctant as much as you can. All right. Okay. Thank you so much, and see you inshallah in the next Tuesday. All right. Yeah. Bye bye.